we're back with you with Dr. Catherine Sevier and Joshua Peck answering your ACA and Medicare questions. Right now, I want to ask this question. All right, Josh, they say, why does there have to be enrollment and a deadline?
Well, all of the entities offering coverage on the health insurance marketplace or healthcare.gov are private companies, and those companies have to balance the profits that they make against the expenses that they incur. And the quick version is that people would wait to sign up until they got sick if there wasn't a narrow window of time when people could enroll, which is why there's an open enrollment period and why December 15th is your last chance to get coverage for 2021.
Yep, December 15th for ACA. Okay, Medicare questions. If I sign up for Medicare and have insurance through work, can I still contribute to my HSA card?
According to Medicare, you cannot. And if you look at the Medicare website, it's very clear about that. It says once you start receiving Medicare, stop contributing to your HSA.
Okay. This person says, I'm a caregiver for my dad. He has Medicare A and B. Do I need to call and update his statuses?
Only if he has changed a supplemental plan. Otherwise, he should be fine.
This person says, I don't want to change anything on my Medicare plan. Do I need to re-enroll?
No.
Okay. I will be 65 next December. Do I have to take Medicare Part B if I don't want it?
You don't have to take it, but if you decide later that you need it, and think about how much of your care you get as an outpatient. You go and you have a lab test, you get an x-ray, you see a doctor. That is what Part B is. So I would caution anybody to think long and hard before I would turn that away, because when you try to get it later, you will pay a penalty.
I'm currently enrolled in the ACA and will be eligible for Medicare next June. Should I get a supplement plan at that time?
Josh, I'm not sure what you would recommend with that. Does the ACA plan convert over as a secondary?
I believe, I don't believe it does, but I think that, first they could call the 1-800 number and they could talk to someone, but I believe you can keep your coverage, until you're 64. And then as you're turning 65, you'll transition over to Medicare.
Okay, this person says, I'm 62. I keep getting information in mailers about signing up for Medicare. Do I need to do something now or wait till I'm 65?
They won't let you do anything now. You have to wait until you're 65.
This person says, I'm retired and have Blue Cross Blue Shield. I'm turning 65 in February. Do I need Medicare Part A and B or just A?
I want to encourage anybody who is looking at signing up for the first time to sit down with someone like SHIP and really have a conversation with them about your circumstances. But I can't personally think of any reason that I would walk away from Part B because of the risk 20 years from now or 10 years from now and the penalty you'll pay.
This person says, I'm 62 and retired and started getting my Social Security benefits. Do I wait until I'm 65 to get Medicare?
You have to wait until you're 65 to get Medicare, unless you're disabled.
All right, this person says, I have ACA insurance with subsidy. My subsidy this year is almost $600 less this year, even though nothing changed with my income. Is there a reason for the change?
Yeah, there are a lot of reasons that plan prices can change even if your income doesn't. First of all, there are lots of different companies offering plans in the marketplace, and every year they can change them. And often competition drives them to change those prices. So it's not surprising that there could be a big change in your prices this year.
And so this follow-up question is, who is eligible for the ACA?
If you're between 18 and 64 and you're currently uninsured, you're eligible to shop on the ACA if you're a United States citizen.
Okay, this person is asking, please explain Medicare Advantage. How can it be a zero premium? What is the catch?
Well, so Medicare Advantage is what you might more commonly think of as a managed care program. So what they do is they take care of all of your needs, but you are working with a group of in-network providers. So where Medicare does not charge either, it is the same. It's the same bundle of money, but it's a different service provision model. And so this one, think of as like an HMO or a managed plan with a very strict network of people who are in that network providing your care. And
the key words there, very strict. So that's interesting. Okay. This person says, if you don't sign up for Medicare Part B at 65, is that 10% penalty just for 1 year or for the rest of your life?
Rest of your life.
Rest of your life. We want to be really clear about that. Rest of your life. All right. This person says, my parents just moved with me to NC from another state. They both had Medicare Advantage plans in their state. What do I need to do to make sure that they still have coverage?
They will need to look, if they want to go with another Medicare Advantage plan, they need to go and look for that. Now, I think that it could be a qualifying event, but I don't know how long they have after they move and establish residency. I would get on the phone with SHIP, tell them the circumstances, and they can help guide them and help through zip code to find what's available in their particular community.
All right. So we've talked about the 1-800 number. We talked about SHIP. We talked about lots of other resources. What we're going to do is we wrap things up, and thank you both for joining us and for answering so many of these questions. We're going to put up the Two Wants to Know web story that is on our website right now, because when you find this web story, you're going to find the phone number and the link for SHIP and for the Affordable Care Act. You're going to find a lot of what we talked about today about those different things about Medicare and also ACA. We want to give you as many resources as possible so that you will be able to make a great educated decision for you.